Welcome to Talk with Healthcare Heroes, Episode 8, presented by Medical Crib. Today I have with me Dr. Sharad Joshi, who is a principal consultant at Max Vaishali. He has an immense experience in pulmonology and he has treated many patients of COVID-19. Today, the topic of talk is COVID-19 and post-COVID symptoms and complications, and many have a raised question on post-COVID symptoms and complications. So he has an immense knowledge and experience and information sharing for you. So tune in. Welcome to Talk with Healthcare Heroes, Episode 8. I have with me Dr. Sharad Joshi, who is a Principal Consultant Pulmonology in Max Vaishali, and he has an immense experience of 13 years. And he is one of the most humble person I know in my organization and always ready to help. And he has been working for the COVID patients 24/7. Nurses have told me that the one consultant who used to come or the one team which comes is pulmonology, and they are very keen to come to the patient and meet them and talk to them and treat them. I am super excited to have you on the show. We'll be talking today about COVID and post-COVID symptoms. Okay. So everybody knows that COVID was an outbreak which devastated globally. And we are still on a search for vaccine, and we really want to kill this bug. Sir, what are the symptoms that we see in COVID?
Look, it's a simple viral infection. All right. So symptoms can be overlapping with simple flu. Right. Almost 50% of patients may not feel any symptoms also. So they may go undetected. But the people who have symptoms or who develop symptoms for this COVID, 90% of patients will have fever. Now, if we talk only of fever, there might be patients who have fever for 1 week or 10 days, which is low grade, which is bothering them. On the other hand, we have patients who have a high grade fever of 102 degree with chills, and it stays only for 2 to 3 days, and thereafter the fever fades off. So fever is one of the most common symptoms. Then there are other symptoms like cough, which is dry, irritating, irritation in the throat. Then there are shortness of breath is another symptom, which is more on exertion. Then few of the patients, they do complain of loss of sense of smell, loss of sense of taste, or I have seen a couple of patients who had really complained of hearing impairment. So there are a variety of symptoms, but most common symptoms are cough, fever, and breathlessness.
So, sir, the trend have been changing. The symptoms are changing. Some people, like you said, some people are asymptomatic and some people are symptomatic. Maybe it could be like a flu, or maybe people would think it's just a fever. So when is the alert point? When do they need to be diagnosed, or when do the samples needed to be taken?
So any symptom which is unusual or any severity which is unusual, they should definitely contact their family physician. And most alarming symptom is breathlessness. So the moment you feel that, okay, your fever has settled down for last 3 days, you don't have fever, but there is new onset of breathlessness, that is the moment you should definitely contact your doctor. Because this virus initially present with fever, but fever might fade off. Later on, the inflammation in the body is going to damage your lung. And in certain number of patients, the inflammation is so intense that it can damage their lungs for the lifetime. We have been seeing these consequences in a lot of COVID patients. Apart from respiratory complaints, there are 10 to 20% of patients who have symptoms like gastroenteritis. So they might have loose motions or constipation and pain abdomen, which will last for 3 to 4 days. That is another presentation of COVID. Right. So you have to be really, really careful.
Because most of them think that no, it would be fever, and people think nowadays because it has been categorized to mild, moderate, and severe. So people think, okay, people are recovering, so we'll also take it very lightly. What do you have to suggest to them?
So, for academic purposes, we categorize these patients mild, moderate, and severe because the management also depends on the category or the severity of the illness, right? So, when we say there are 40 to 50% of patients who are asymptomatic, they will not have much of symptoms. They will come across this virus, their body immunity will take care of this virus, and they will not generate too much of symptoms. The mild disease is when, specifically, you say when the respiratory rate is not more than 25, 24 per minute, or your saturation, the oxygen saturation levels has not dropped down below 94%. That is a mild disease. When your saturation level has dropped down between 90 to 94, or your respiratory rate is between 24 to 30, it is a moderate disease. And when your respiratory rate is more than 30 per minute, or the saturations are going below 90 degree, it is a severe disease. This is how you categorize. In severe disease, there is onset of ARDS, which is a more technical definition. When the PaO to FiO2 ratio goes below 300, it is ARDS. When this ratio goes below 200, it is moderate ARDS. When this ratio goes below 100, it is severe ARDS. So in severe disease, we have category of ARDS also. Otherwise, in certain patients, when there is blood pressure is going down, so a disease of COVID-19 pneumonia with shock, septic shock, that is also categorized as a severe disease, right?
Yeah. So nowadays, because they have been diagnosed COVID, and some people they home quarantine themselves, and some of them gets hospitalized. So what would you suggest, sir? Like they should be home quarantine or they should be in the hospital?
Look, if we suggest that every patient of COVID, even with mild symptoms, should get hospitalized, then definitely in a country of 1.3 billion population, will definitely be short of hospital beds. So it is not advisable. The best thing is, like we have seen earlier also, that n number of people out on the street started using N95, and that led to scarcity for healthcare workers. Right. So when we are short on resources, we have to be very judicious while utilizing them. Right. So if there is mild disease, it is mild fever which stayed for 2 to 3 days. Your cough is settling down. Your sore throat is not troubling. There is no breathlessness. Definitely, home quarantine is the best way of doing it.
If the patient is home quarantine, what would you suggest them to do?
From the pulmonologist point of view, I think now everybody knows that pulse oximeter is a very vital instrument, especially monitoring these patients of COVID-19. So most important thing for home quarantine is that you should not be alone at home, because if you come across some medical emergency, it will be very difficult for you alone to handle it or to call an ambulance. So if you are staying alone, then you should prefer hospitalization. Second thing, the pulse oximeter should be very handy, so that you should be monitoring your oxygen saturation level. The moment you feel that, okay, from bed to bathroom you are feeling breathless, or while having a walk inside your room you are feeling breathless, you should immediately check your oxygen level through the pulse oximeter. And if you find that it is going below 95 or 94, you should stop home quarantine, you should get hospitalized. These are two most important things which
So
you
it is,
monitor home quarantine.
yeah, so it is below 94 that you have to seek for the medical help, right? So, sir, how, because we don't have a medication for specifically, like, there is a medication that we can treat COVID, but then we are finding solutions for the symptoms. So, what is the major, I mean, medical treatment that you do?
We can't say that there is no treatment right now. Now we have been using antivirals very regularly in these patients. Right. For mild disease, we have drugs like doxycycline, ivermectin, SCQS, or Fabiflu, the favipiravir. Right. So these four drugs are very commonly being used in mild diseases, and we can have permutation combination of these drugs according to the comorbid illness or certain risk factors which patient has. Like in a cardiac patient, you will not like to add SCQS as a drug. Or patients who have liver disease or their liver dysfunction on their blood test, definitely you will like to be cautious to add favipiravir. All right, but we are using these drugs in a different various combinations for mild disease. Right, for fever, definitely Calpol 650 or paracetamol 500 mg. These are good enough to control the fever.
Mhm.
Right, and other than this, multivitamin and zinc combination along with vitamin C. You should definitely check your vitamin D levels also, because 80% of Indian population is low on vitamin D, so that should be supplemented in appropriate doses.
Okay, sir. The incubation period, as it said, it's 2 to 14 days. So how long would the virus be contagious? Like if somebody has a COVID, is turned to be COVID positive, and how long will the virus be contagious?
It's a very tricky question, because even in patients who are COVID positive, the shedding of virus is very periodic. It's not a regular thing that patient is going to shed virus for from day 1 to day 5. It is not. So there are periodic surge in virus shedding. So ideally, what ICMR suggests us that from the onset of symptom, day 10 is one thing which will decide that the infectivity of a person has gone down. That is the most important thing. But in our practice, we have been seeing that even in mild to moderate and severe cases, there are patients, if you perform their COVID-19 test, it will turn out to be positive even at week 3.
Hmm.
So, because of this test of RT-PCR, we cannot judge the infectivity of the patient, because even a dead virus will give a positive RT-PCR.
Hmm.
So a positive test will never define that the patient is infectious or not. So the most infectious period is from onset to day 10. That is the most infectious period.
So, like we follow mask, we follow the new normal, that is social distancing and mask. And there are some videos that comes up like there's no point in putting the mask, and people are also taking it very seriously. So, what is the authenticity of it, sir?
These are really misguiding videos. As far as best precautions available against COVID-19, definitely you should follow social distancing, and mask is a must. Mind it, I am repeating it. Mask is a must. So wearing your mask with covered nose and covered mouth, it is very, very important. That is one single step which can prevent you from getting COVID-19 infection. It's a very important step. It should not be ignored at all.
What about, sir, like it can it spread through like food?
So even till now, researchers are like, initially they said that it is an aerosol infection. So it is a
Okay.
droplet infection which is spread by droplet. Later
Hmm.
on, they came that okay, this is a airborne disease. They also said that it can spread with fomite also, so the virus can survive on surfaces for long, and if you touch the infected surface, that virus can transmit it. So till now, even they are confused. But
Okay.
in practical experience, in last 4 months experience of handling all these serious patients and COVID patients, we have observed that most important protective device is a face mask, and that has to be worn in a proper manner, covering both nose and mouth, and avoiding any repeated touching of your face and repeatedly adjusting your face mask. These are very important steps, should not be ignored.
Okay. So like there's a point that when we do aerosol generating procedures like suctioning, um,
Bronchoscopy.
nebulization, we have to be more careful when you are doing aerosol generating procedure. So only N95 mask is enough, while this is especially for the medical professionals. So what is your answer, sir?
Look, as a medical professional, we try to avoid any aerosol generating procedure in these patients, right? So if a patient who is COVID positive, who is having severe pneumonia, ARDS, and he needs an intubation, definitely you need N95 to be worn by the person who is doing the procedure. When you have been seeing these videos and those advices that whenever the patient is being intubated, you should cover their face with a hood or a polythene so that the aerosol doesn't spread to the entire area of emergency, right? Same way, we have avoided doing nebulization to any of the patients. Even if they are asthmatic patients or COPD patients, it is better to give them inhalers rather than using nebulizers, right?
Yeah.
If you talk about performing the procedure of bronchoscopy, definitely it has to be done with the double mask. One of them should be N95 and a face shield and then PPE. So that much of protection is required for all these very highly aerosol generating procedures.
Okay. Sir, now we've been seeing that there is post-COVID complications or post-COVID symptoms, because once we see that, okay, I've been COVID positive, and then now I am immune to it. But now we see the trend of post-COVID complications, post-COVID symptoms. So what are the post-COVID symptoms that we see nowadays?
Uh, just one more point before coming directly to this question. The important thing is there are people who have mild disease and there are people who have moderate or severe disease. So even the patients with mild disease are facing post-COVID complications, post-COVID symptoms. But their post-COVID symptoms are like a persistent fever, which is low grade, which is coming in afternoon, which is bothering them. It is giving a feeling of malaise. There is nothing else. But it will persist for maybe 3-4 weeks, but it will settle down. There are patients who complain of muscle aches, joint pains, body ache, extreme weakness, inability to swiftly get up from bed, or feeling tired even till walking till the bathroom. So these kind of symptoms can persist even for 2 months. There are patients who are complaining of throat irritation and dry, hacking cough, irritating cough for 2 months. Considering all these common post-COVID complications, I have seen one patient, very interesting patient today. She had post-COVID urticaria. So she recovered very well from a mild to moderate disease, but now she has got severe urticaria. So every now and then she gets rashes and itching across his, all the limbs. So, and there are disfiguring pigmentation on her hands. So that is one of the very rare complication, but there are post-COVID complications which are occurring to patients, and they will more or less will settle down in a period of 2 months. Definitely, it will require symptomatic treatment and repeated visit to a family physician. But there are very serious, crippling consequences of COVID, and which we are seeing in severe and moderately severe cases. The patients who are recovering from ARDS, who had really white out lung during their ICU stay, now they have recovered, their hypoxia has improved, but they are not normal. They have not attained the normal oxygen levels, and their COVID test has turned out negative. Right. So their oxygen requirement is still persisting. There are patients who are being sent home on domiciliary oxygen. They are using oxygen at home. When we perform CT scan of these patients, there is a pulmonary fibrosis. It's like interstitial lung disease or ILD like changes in their lungs. And in few unfortunate patients, these changes might persist for years or maybe for their lifetime. So that is most troublesome thing, right? Even treating this, because fibrosis is a chronic process, it doesn't occur within 1 or 2 weeks. But unfortunately, in COVID patients, COVID ARDS patients, we are seeing a rapid onset fibrosis, pulmonary organization of pneumonia, and rapid fibrosis inside the lung parenchyma.
Is there any way to prevent this post-COVID complications?
Look, problem is that there are no predictors of it, that who is going to have it. So our concern presently is focused on preventing interstitial lung disease or pulmonary fibrosis, which is occurring in severe cases of ARDS secondary to COVID-19, right? So we have to identify these patients very early, and we have to start their preventive antifibrotic treatment early, as well as we are giving these patients antifibrotics like we have been using in ILD patients. Right. So we are starting their treatment early, and they are showing some recovery, but that's going to be very, very gradual. It will be a very slow process. Right. So
Yeah.
that is difficult, but there is no predictors that this patient require an early treatment or this patient is going to land up in pulmonary fibrosis. So it's not that it's something which is preventable. It's very
Correct.
difficult to identify.
You want to add on something to the people out there?
Look,
Then
there
I
are
have a
few
last question
things.
for you.
All right. So there are few things which everybody should know. The important thing is COVID-19 is a new virus for every person on earth. It has different, and it's a variety and a spectrum of a disease. It There are patients who will be asymptomatic. There are patients who will get mild disease. There are patients who will have severe disease, and there are patients who will not survive this disease. So fortunately enough, in India we are not seeing a mortality more than 3%, which is a good part of it.
Yeah.
But the patients who are stuck in severe disease, who are suffering inside the ICU, their normal health is totally unpredictable. We do not know even if they recover from COVID, whether they will have a normal life ever in their lifetime is still doubtful, even if they recover from the acute stage. All right. So, as a normal citizen of country, it's everybody's responsibility to follow the guideline, to follow social distancing, to definitely protect themselves by wearing masks.
Yes.
Right? These things have to be followed. This is a new normal, as you shared earlier, Ravi. Right? So that is new normal, which has to be accepted by everyone. It's a different curve altogether. Initially it was very, very frustrating, maybe in the month of March, when we had very few medications. We initially we had no remdesivir available in India. The tocilizumab was not available. Even the plasma therapy was not available, and plasma therapy was a investigative thing, so it was only being practiced at two centers in Delhi NCR. So initially we had patients and supportive treatment. So the mortality rate was high and it was very frustrating for the treating team. Later on, with the availability of these salts and availability of plasma therapy, remdesivir, tocilizumab, we had seen very good response in certain number of patients, and that gave us a confidence to take care of serious patients.
Mhm.
Right. So Uh, one thing which is still frustrating is that you cannot predict that who is going to have serious disease and will not make out of that ICU. I have seen, like they say, that people with multiple comorbid conditions, diabetes, old age, and COPD patients, patients who have lung diseases, chronic lung disease in early, as a comorbidity, will have a serious disease. They are very high risk of having death or other complications. But surprisingly, we have sent two patients home who were suffering from severe disease of COVID-19 and had blood cancer. They
Wow.
recovered and went home. I have personally seen that there are n number of patients who are on dialysis for years together. They are chronic kidney patients and they recovered very well within 5 to 7 days and went home. So even diabetic patients,
Mhm.
they went home very well. So these are not predictors; they are just risk behaviors. And very importantly, obesity, overweight people, they are very high risk for COVID mortality and morbidity. They are at higher risk than the diabetic patients, which has not been very well highlighted in literature. But personally, we have seen that patients who are obese, they have suffered more than any diabetic patient. So these are few learning points which we have seen. We have seen families altogether admitted in one hospital, one ICU. So this is a devastating disease. Everybody should pay attention to the precaution. That is most important.
Kudos and salute to you and your team, sir. You have done a very great job, and where people are quitting, you have given your hand and helped so many people. Thank you, sir, and thank you for joining in.